Hello, good afternoon, and welcome to our session, Minding Our Mental Health in Good Times and Bad. I'm Don Wildfong from the Waterloo Wellington Older Adult Strategy, and I'll be facilitating today's session. The Waterloo Wellington Older Adult Strategy represents a 10-year transformational plan to optimize the health of older adults in Waterloo Wellington and strengthen the performance of the systems that support them, their families, and their caregivers. We're delighted to be co-hosting this session, part of our Knowledge Exchange series during Mental Health Week with the Canadian Mental Health Association Waterloo Wellington Senior Services team. Today's session is being recorded so that it can be shared broadly. Please know that we're not able to see or hear any of the participants, and your faces will not be captured on the recording. We invite you to share your questions and comments in the Q&A section and are eager to respond to them once all of our presenters have had a chance to speak today. So this year, the theme of Mental Health Week really rests upon the importance of understanding our emotions. Recognizing and labeling and accepting our feelings are all part of protecting and promoting good mental health for everyone. Good mental health isn't about being happy all the time. In fact, a mentally healthy life includes a full range of human emotions, even the uncomfortable ones like fear, sadness, and anger. Feeling sad, for instance, angry and anxious at times is part of being human. Even if we try to push our difficult feelings down, they don't go away. Focusing on intense emotions doesn't make them worse. In fact, one of the best ways to quiet our emotions is to give voice to our feelings. Bottling up our emotions can make them grow and come out in different ways. Not reacting to something negative that happens in our life could end up making you more likely to lash out to someone you care about, for example. If your emotions are overwhelming, persistent, and are interfering with your daily functioning, it's important to seek mental health support. With that said, let's get on with our session today. So today we'll learn about, together, the following outcomes: promoting and supporting mental health and wellness as we age. We'll hear about things that place older adults at risk for developing mental health conditions. We'll talk about and learn more about coping with mental health conditions as we age and learn more about some resources that are available in our community. As mentioned, we are very fortunate today to be joined by 4 of my colleagues from the Canadian Mental Health Association Waterloo Wellington Senior Services team. They are, I'll introduce them now, and they'll begin their presentations following their introduction. First, we'll have Victoria Peters, who's the manager of Senior Services. She'll be followed by Heather Questra, who's the mental health clinician for specialized geriatric service, followed by Samantha Kim, the vulnerable seniors lead at CMHA. And closing us out will be Cherylee Fessenden, intensive geriatric support worker, or service worker, pardon me. So without further ado, I'd welcome Victoria to begin our presentation.
Thanks so much, Dawn. And on behalf of Samantha and Cherylee and Heather, I just want to thank Dawn and the Older Adult Strategy for inviting us here today to share our insights on seniors' mental health. My colleagues and I from Canadian Mental Health Association Waterloo, we work every day to improve the quality of life for older adults who experience difficulties with their mental health, who are isolated, and who also live at risk. And what we want to share today will highlight not only the negative impacts of COVID-19, but we also want to offer insights on resilience, hope, and coping strategies. Since the onset of the global COVID-19 pandemic, older adults have certainly disproportionately experienced the adverse effects from the pandemic, including more severe complications from the virus, higher mortality rates, concerns about disruptions to their daily routines and access to care, the need to adapt to technologies like telemedicine, and concerns that isolation would contribute to or even exacerbate mental health conditions. So much has happened in this past year, and as I said, disproportionately to the older adult population. So having said that, it is vital that we recognize and validate and normalize these impacts on older adults and call attention to what we can term pandemic fatigue. Pandemic fatigue can manifest in different ways. If you're feeling restless or irritable, it can show up as a lack of motivation. It can be difficulty concentrating on tasks, withdrawing from social relationships with others, and changes in your eating and your sleeping habits. And the word change is key here. Recognition of changes within yourself or loved ones is extremely important and can lead to the development of self-awareness and increase in your own health literacy. It's about recognizing also that despite pandemic fatigue, that good mental health, as Dawn mentioned in the intro, it's not about feeling good all the time. It's about appropriate emotional and behavioral responses to life's ups and downs and stressors. And sometimes when you're sad, you just need to cry. And when you're angry, you just need to vent, but hopefully in healthy ways. So it's important that we really lean into these very real emotions and consequences, the feelings of loss and withdrawal, the loneliness and uncertainty, but that we also lean into strategies that will assist to cope and build resilience. And as we go through the webinar, Samantha and Heather will touch on those things as well. So I read a great analogy a couple of weeks ago in a Time magazine article. And most of you will know who Margaret Atwood is, and she's a famous, one of our great Canadian authors. And she said in the article, do you remember a movie in which a knight gallops towards a castle just as the drawbridge is going up, and his white horse jumps the moat in one glorious airborne leap? And so she says that we are that rider, and chasing us is the coronavirus, COVID-19. We're essentially right now in midair, hoping that we make it to the other side, where life will have returned to what we think of as normal. So the question is, what do we do while we're up there between now and then? And Margaret Atwood invites you to think of all the things you hope will still be there in that castle of the future when we get across. And so what do you do now to ensure the future existence of those things? Ask yourself, what made your life worth living pre-pandemic? We all have our own lists. And as important as it is to lean into those feelings of loss and uncertainty, it is also imperative to focus on hope and what is to come and our own resilience. So asking yourself a question, and I love this question, it's very simple. Ask yourself, how have you managed to carry on in the last year? Write out a list of all the things in your life that have enabled you to make do and carry on during this very difficult time. Simple things like thinking positive thoughts, thoughts of anticipation and hope. These are not complicated. They're very, very simple coping strategies that anybody can hopefully employ a little bit at a time. We want to move forward inch by inch, as opposed to believing that we'll go from the end of a continuum right to the other in a matter of seconds. So other things that can be helpful are staying in touch, initiating phone calls and emails, getting some fresh air, even if you can only open a window, take awe in nature, looking out that window. Turning off the news is a big one. Excessive media consumption can really feed our negative thoughts and our uncertainty. Moving your body every single day. Some of you may have heard of the expression, movement is medicine. Physical activity absolutely helps to improve the lives of older adults. Given that we need to respect the social distancing guidelines, absolutely, but it really helps to maintain levels of good chemicals in your brain. Even journaling and meditation can reveal aspects about yourself, like your strengths and opportunities for growth. When you're thinking about that question, how have you managed to carry on? Like I said, writing it down can be helpful. And just overall be proactive and take care of yourself physically, mentally, and spiritually. Sometimes though, taking care of yourself can be difficult because of stigma. And stigma is identified or described as negative attitudes based on a distinguishing characteristic such as mental illness or even aging. Stigma deprives individuals of their dignity, and it reinforces destructive patterns of isolation and hopelessness. And above all, it can prevent us from reaching out. One of the key takeaways of our talk today is the hope that it will inspire those of you who are listening or have a loved one that needs help to reach out. So I just want to demystify and reduce some stigma around some common myths that can exist around aging and among the older adult population. The first one is that dementia and memory loss is a normal part of aging. This is actually one of the most prevalent misunderstandings that prevent older adults from getting treatment or reaching out. Memory loss and loss of cognitive function are not always attributed to dementia, and sometimes there's even an organic cause for absent-mindedness or a lack of memory. The second myth is that depression is common among older adults and or untreatable. And this is also not true. It's absolutely treatable and not more prevalent in the elderly population. Depression can also affect cognition and can be misdiagnosed as dementia. The third and very important one that we want to touch on is that addiction is not a older adult mental health problem. Sometimes substance abuse is under-recognized and not thought to be a problem among seniors, and consequently, it can be left undiagnosed, untreated, and sometimes not even screened for. The fourth one is that older adults, there's this myth that they don't respond well to seniors' mental health treatment because they're so set in their ways. We know that that's not true, but this can lead to the damaging perception that older adult mental health issues are untreatable, and this isn't the case. And then the last one that I'll share with you, the myth around getting older and aging, is that older adults are beyond their functional years, so why bother? And this is just an absolutely erroneous mindset and a grave error in judgment. And statistics indicate that many older adults stay healthy simply because they are active and contributing members of society. So it's very important to name the myths and the things that stigmatize aging and mental health. And I want to say that one potentially hopeful outcome of the pandemic is the destigmatization of mental health and an increase in health and mental health promotion and early interventions. Mental health has been in the news more than ever, and we really need to grasp onto that and encourage those of us and our loved ones who need help to reach out. Another hopeful outcome of the pandemic is around our resilience and even our wisdom. Over the last year, interestingly, some studies have shown that older adults were less likely to experience pandemic-related anxiety, depression, and stress because they have such a reservoir of knowledge and skills that have helped them cope with challenges over so many decades. Resilience is something that anyone can learn at any time. And it is developed over time. It's a process and not a personality trait. So I do not want in any way to minimize the very real scale and magnitude that the pandemic has had on older adults, but this impact may have been partially countered by a wide range of coping mechanisms that older adults have. We also need to consider wisdom, which is a complex personality trait comprised of very pro-social behaviors like empathy and compassion, emotional regulation, and the ability to self-reflect, decisiveness amid accepting uncertainty. And many studies suggest that older adults tend to exhibit these traits more often as well. So it's important to rely on and recognize the resilience and wisdom that so many older adults possess, and continually encourage that self-awareness and self-recognition of not only what's not going well, but the strengths and what is going well. Our hope is shifting all the time in this pandemic. We have to continue to hope, and by hope shifting, I mean that a year ago, we were hoping that in flatten the curve in 2 weeks, we'd be out of the woods. But we know that now we're hopeful that the vaccination rollout will continue to be timely and that we can hug our family members really soon. So at the end of the day, I want to also recognize that many older adults do not have the resources required to deal with the stress of COVID-19. These can include material, social, cognitive, or biological resources, inability to engage in physical exercise, etc. And where people are struggling, this is where organizations like the Canadian Mental Health Association can help. Our senior services offer clinical and instrumental support, and our work often focuses on how the absence of resources can be mitigated for individuals and caregivers. So regardless of who you are, older adult yourself, caregiver, a healthcare provider, right now we're all up in the air. And I do encourage you to imagine what your life will be like once we get to the other side of that drawbridge. Thank you.
Thank you very much, Victoria, for your reflection and for your comments today. I'm sure they're landing with people and viewed as very helpful. The context has been such that we've all experienced such profound loss and a range of emotions over COVID-19. So we appreciate you sharing that with us today. In fact, our CEO of CMHA, Waterloo, Wellington, said, in fact, there's never been a more important mental health week since the onset or since the beginning of Mental Health Week. So thank you, Victoria. We'd like to now welcome Heather Questra to take us through her presentation, please.
Good afternoon, everyone, and thank you to Dawn for that introduction. Early on in the pandemic, someone shared the following saying with me, and I found it very helpful throughout. We are not all in the same boat, but we are all in the same storm. And I like the idea that our individual experiences of living through this pandemic have been different, and yet there's a collective experience of the pandemic that we're all experiencing, and we are all being impacted regardless of what the last year and a bit has been like for us. This graph was produced by Dr. Deb Thompson of Thrive with Coaching and Counseling, and I just find it very helpful. Dr. Deb Thompson says, it's normal to have challenges with energy, motivation, and focus right now. These capacities are sourced by your brain, the same brain that is very busy trying to cope with fluctuating overload of many other thoughts and feelings and problems. Just like your computer is slow when too many processes are looping and grinding in the background, our brains have genuine limits. Be gentle with yourself, minimize priorities, try to recharge as best you can, seek support, and muster as much self-compassion as you can for this new normal, including feeling more fuzzy and less effective. And I love that quote, but I also just love the idea that as we're living through this pandemic, our brain is coping with a lot of additional information. And so we may be feeling a little bit not as sharp as we would expect to be. Might feel like we're more tired at times, or just that things are a bit overwhelming. And some of that may be attributed to just the state of the pandemic and where we're at in it right now. So what does this mean? I would say that regardless of what our perspective is on COVID-19 and the current restrictions, I hope that we can all agree that our current reality is different from what we had expected to be in May 2021. Everyone is being impacted in different ways. Some people are feeling increased depression or anxiety, or grief or loss for what could have been, feeling isolated or lonely, or possibly overwhelmed. Some people don't feel impacted at all. Some people are very worried about leaving their homes. Some people are just feeling sick and tired of the whole thing and talking about the pandemic. Some people are feeling relief because they don't have to leave their home quite as often as they did before. And so the reality is that there's a lot of emotions going on. There's a lot of things happening, and life continues to go on. We still hear about births and deaths, important events such as anniversaries and birthdays. Our health continues to change. And so there's just a lot of things that need to be considered and approached as we live through this pandemic. So as Victoria had talked about, it's important to be mindful of what makes you tick. Victoria had talked about some important self-care strategies that may be helpful. Just being mindful about what might relax you. What are things that you do to distract yourself if you're having a bad day? What do you do to stop from feeling overwhelmed? What are your warning signs for when maybe you're just feeling tired or fed up? These are important things that can help us to navigate through the day-to-day reality where we're at right now. That being said, we do need to acknowledge that for some people, the pandemic is contributing to significant depression or anxiety, or it's exacerbating their other health or mental health concerns. As Victoria said, we hope that one of the primary takeaways from this talk is that if things are feeling overwhelming or too much, or you're feeling like your ability to cope on a day-to-day basis is being overwhelmed, that you seek help. That's really important, to reach out if you need to, or just to talk to somebody to see what other supports might be available. So now I just want to talk about a few mental health conditions that people may have heard of before, and that we recognize are common for older adults and indeed for many people in the population. So depression, which is commonly associated with anxiety, it is a psychiatric disorder that it can be common in later life. It can be associated with physical ailments such as chronic pain or difficult health diagnoses. Sometimes depression can come alongside some of those conditions that people live with. It is common in people for folks who are over the age of 75. Under the age of 75, depression is more common in women. Over the age of 80, it's more common in men. Some signs and symptoms of depression, which is the next slide, Dawn, may include things like just feeling loss of interest or pleasure in activities, feeling like you just don't have enough energy or motivation to start a task or to complete something, feeling like your mood is just really blue all of the time, feeling sad or empty, feeling slowed down, or alternately feeling very restless and feeling like you can't sit still. Feelings of guilt or worthlessness, just wondering kind of what might be out there or what things are still left to accomplish, can be common when people are experiencing a depression. Sudden changes in weight or appetite, so either eating a lot more or a lot less, and corresponding weight changes can be a sign of depression. Thoughts about death or suicide persistently can also coexist with this illness. Difficulty with thinking or concentrating or making decisions is often very common as a sign of depression as well, and sometimes can actually be, if somebody is struggling with a depression, that can be misdiagnosed as kind of other more significant memory difficulties. But the doctor that I work with would always say, we want to treat your mood first, and then we would do further assessments around memory just to make sure that there's kind of nothing more serious going on. And sleep changes as well are very common with depression. There's lots of different treatment options for depression. Again, if this is something that you feel, if you're feeling like your mood or the mood of a loved one is prolonged, it's intense, or it's intruding into your daily life, we recommend that you talk to your doctor or your nurse practitioner about that. Medication is a form of treatment for depression, but there are other treatments that your doctor or nurse practitioner would speak with you about. Things like trying to have good sleep hygiene, eating regularly and well, being social, keeping your brain occupied are equally as important as the medication. And those are things that you would talk to your doctor or your nurse practitioner or your healthcare provider about to determine what's the best treatment for you. Another condition that I just wanted to briefly mention, because we understand that some older adults and people in general have not been seeing their doctor in the same way during this time of COVID-19. And delirium is a condition that we would certainly say if you suspect that you might have a delirium, or if you suspect that someone around you has a delirium, please reach out for immediate medical support. It's very serious. Delirium is characterized by a really sudden change in our consciousness. So maybe increased difficulty following a conversation, inability to focus our attention, having kind of sudden bursts of energy or feeling really sedated. This comes on really suddenly. So it can come on within hours or days, and it just all of a sudden the person is just not themselves. This is a condition that's more common than having a cold or a fever for older adults. And things like having an infection, such as a urinary tract infection or a lung infection, having withdrawal, say, from a medication or from a substance, or acute medical changes can trigger a delirium. And again, if this is something that you suspect for either yourself or a loved one, please seek out immediate medical attention. Memory is something that many people are very mindful about their memory as they age, and certainly we hear a lot about memory conditions such as Alzheimer's disease or other dementias, and certainly it's something that people are mindful of. As I mentioned earlier, the pandemic, with that extra layer of just kind of things to think about and be mindful of, can sometimes make us feel like our memory isn't as sharp as it has been in the past. Memory typically develops over months to years, so over quite a prolonged period of time. Many people will say to me in my work, oh, I'm getting older, so my memory is not as sharp as it once was. And that may be true, but we also do want to reiterate that memory changes are not an expected part of aging. And so therefore, if you're concerned about memory changes for yourself or for a loved one, please reach out to your healthcare provider. They would most likely make a referral for you and would have a much more fulsome assessment about what changes you're noticing with your memory, what concerns you're having, and then would kind of make some recommendations or some referrals on your behalf. As we mentioned before, sometimes depression and memory can be really intertwined. And so again, please talk to your family doctor. Substance use is another mental health concern that we see regularly in the population that we serve. Substance use, a problem exists if a person's substance use is having an ongoing negative impact on their life or on the people who are close to that person. The image on this slide just indicates what are some safe guidelines for or what we would constitute as calling a standard drink. And there are a number of resources available in the community about safe or recommended guidelines for alcohol consumption. Or on the next slide, there will be the recommended guidelines for how to use cannabis. If that's something that people have used, then there are some recommendations about how to do that safely, things to consider. And again, if this is something that you would like more information about or have concerns about your use or the use of someone around you, please reach out to your healthcare provider. The last thing I just wanted to talk about is suicide or thoughts of suicide or thinking about death or dying. This is certainly something that can be very common in people across the age span, but is also common in older adults. Many people experience thoughts about death or about suicide at some point in their life, and many people don't talk about it, but we need to. Suicide ideation, thinking about suicide or thinking about wanting to end your life, or a passive wish to die, thinking things like, I wish that I would just not wake up in the morning, can be a sign that something more is going on with your mood. If you are experiencing these kinds of symptoms or these kinds of concerns, these kinds of thoughts, please reach out. It is something that when you talk to a healthcare provider, they will take very seriously. And if they have concerns about your safety or about the safety of others around you, then they will take steps to try and ensure safety for everyone involved. And so, yes, we just encourage you that takeaway. Please reach out for help if you're experiencing difficulty.
Thank you, Heather. That was a great orientation to some of the most common conditions facing older adults. And As we know, 1 in 5 of us will experience a mental health condition over the course of our lives. And far more of us will be very familiar with someone who has, very close to us in our family or a close friend. So it's important that we build our literacy around mental health, and we thank Heather for sharing that with us. We're now pleased to welcome Samantha Kim, who's the Vulnerable Seniors Lead with CMHA. Samantha.
Thank you so much, Dawn. So I would like to talk today just a community approach to coping with loss and grief. So the last 15 months have been very difficult for many of us. It is important to acknowledge the loss of things that once seemed so normal. We need to recognize that everyone's loss is real, even if it seems small to you and I. Recognize that others are experiencing these losses too, and that this is shared across our society. We have all experienced some sort of loss during this time, whether it be loss of a family member or friend, miss being able to participate in the traditional rituals, such as weddings, graduations, holiday traditions, such as Thanksgiving and Christmas, and many more. Normalcy of our daily routines that give us our purpose, such as going out for daily coffees, commuting to work or volunteering. Missed hugging their grandchildren, that physical connection we have with our family and friends. Not being able to volunteer as they usually do within our community, which is giving back to our communities. And the next piece I would like to touch upon is understanding grief. These losses can build up and lead to feelings of grief. Grieving any kind of a loss takes emotional energy and time. And I want to emphasize this is normal. Give yourself the space to make sense of your feelings. And thankfully, some of these losses are only temporary. There are different types of grief that someone may experience, such as ambiguous grief, the one that many of us may be feeling right now. It is a loss that occurs without closure or clear understanding and often results in unresolved feelings. It is difficult right now, as we don't know when the pandemic will end and when we can get back to what life used to be like before COVID. The losses to our pre-pandemic structure and routine was rapid, and the unknown of an ending of the pandemic is stressful. Another type of grief is latent or hidden grief, often associated with caregivers of individuals with dementia. It attributes caregiver burden to the hidden grief that comes with losses associated with dementia, such as a loss of memory, loss of relationship as they once were, or even the loss of mobility. The last type of grief that I'd like to touch upon is anticipatory grief. This refers to our feelings of grief even before a loss occurs. We may be anticipating even more losses, such as income, autonomy, freedom, because of further restrictions that we're facing. Even though our worst fears may not come to pass, anticipating them can lead to legitimate feelings of grief and stress. So I'd like to also touch upon some suggestions for coping that my colleagues Heather and Victoria had talked about as well too. Remember, these are only a few suggestions that may be helpful. Perhaps list the ways that your friends and family have touched and influenced and enriched our lives. Do what you can to support others who may be experiencing these and other losses. Continue to nurture and draw on your faith and spirituality as a source of hope. Make a list of what matters most in your life. Ground yourself and find strength in that. Like the other coping strategy Victoria talked about, take time, get some fresh air. Begin and end your day with hopeful and positive thoughts. Balancing bad thoughts with good ones. Focusing on the present, being mindful. This is a hard one, but letting go of things you can't control. And I encourage stocking up on compassion for yourself and others. Social isolation and loneliness. Social isolation is defined as the objective state of having few social relationships or infrequent social contact with others, while loneliness is a subjective feeling of being isolated. While we have all grown weary about news of the pandemic, for older adults, particularly those living alone, loneliness can be debilitating and have negative effects on their overall health. It has never been more important to show older members of our community how much they matter to us. In our community, there's a growing number of isolated, at-risk older adults who have no support system, such as family or friends, to act on their behalf. This is a loss of connection. Older adults were already at a higher risk of social isolation and loneliness prior to the pandemic due to factors such as living alone, the loss of family or friends, chronic illness, and hearing loss. During the COVID-19 pandemic, the needs of older adults in our community are heightened with social isolation and distancing. We're told to distance ourselves from others. Social isolation is considered both a risk factor for as well as the risk of elder abuse and neglect, and is also known to have significant effects on the health of older adults. This can be a risk for dementia, premature death, higher rates of depression and anxiety are just a few examples. You may be wondering, what can we do as a community? So as a community, we can learn more about social isolation and the effects on our older adults. One resource that can do that is the Waterloo Wellington Neighbor Program. The Waterloo Wellington Neighbors Program is an education program to increase the community's awareness about the signs of socially isolated and vulnerable older adults. It is based on the principle that the care of a vulnerable citizen is everybody's responsibility, and helping each other contributes to a better society. While older adults in our community may be isolated more than ever, those who work and live in our community have the potential to be the eyes and ears on the ground. We want to support people to stay in their homes safely for as long as possible and to support independence. Some possible signs of vulnerable older adults to look for as a member of the community, if you regularly interact with older adults. Perhaps you notice changes in the way the person looks or expresses themselves, looking sad or lonely, or in the way they're acting or behaving. Noticeable changes with their memory or recent confusion, social isolation, which we've talked about, substance use or misuse or dependence, as my colleague Heather had mentioned, self-reported or other reports of other elder abuse, noticeable signs or changes in hygiene, concerns about malnutrition, safety concerns including wandering, falling, driving, unsafe housing conditions, or unstable housing. And some of the reasons why someone may not seek assistance, and you might be wondering, why they haven't ever reached out for help before. The person in question may be embarrassed of their situation, afraid of losing their home by eviction or placement, feeling fear of being a burden on others, in denial of needing help or assistance, fearful of losing their independence, experiencing loss, depression, or cognitive impairments, not aware of the supports that are available in the community. So this program, again, is about increasing the community's knowledge about social isolation and vulnerability in older adults, and learn about connecting the person to community services. I've included a link if you want to learn more, and an email if you want more information about this program. So I'd like to conclude my section before moving on to Cherylee, is that I often think about this quote from Helen Keller: "Alone we can do so little, and together we can do so much." Thank you.
Thanks, Sam. That was great. It's so helpful for us all to know a bit more about the conditions that predispose vulnerability in people as they age. And very exciting, I'm sure our participants and listeners will feel with the new program, Waterloo Wellington Neighbors, as that gains momentum and expands across our region. Thank you for your leadership in that. We'll now welcome Cherylee to finish out the presentations, please.
Thank you, Dawn, and thanks to everyone who spoke before me. I feel like I'm the good news girl today. There's one main message I want to share, and it's that, today the world is very different than it was prior to COVID. COVID forced us to change the way we do business and how we accept supports and access support services, but we're still here. And as Heather stated, that we know that as we age, mental illness takes on a different lens. While these may not be normal times, you do need to still reach out to your family doctor. That's the main message for us today. They are open, they are seeing people. It is a bit different. Don't put off giving a call. For the elderly folks I know, Most doctors' offices are open for face-to-face visits, not just virtual care. Your local emergency room is also open should you need to seek urgent medical attention. Please do not go to the hospital if your condition is serious. And if you don't have a family doc, there is always free medical advice from Telehealth Ontario. It took a while for us all to figure out how we were going to do business, but we're doing it now. And the community support agencies have adapted their service in order to support the most vulnerable. And these services do vary from region to region. The best way to find out what community support services are in your area is through CareDove. It's a simple one-stop shop online portal. All you have to do is type in your home address, a postal code, and you can find a service provider in your area. They have listings for adult day programs, meal support, transportation support, friendly visiting, all at the click of your finger. The website is here, and if you want to find out more information, give it a click. The other thing to know about CareDove is that this can be accessed by your community care coordinator as well. They are, as I say, the one-stop shop for all services that you need. Dawn, if you want to go to the next slide. The Home and Community Care Coordinator can access CareDove on your behalf and register you for services as needed. I also need you to know that if you're in a mental health crisis, Here 24/7 is open. It is a call-in phone system that has access to 24 hours a day, 7 days a week, a live person to help talk you through your mental health needs. They also have a referral system as well that can hook you up with telephone reassurance, peer support groups, all at your fingertips. Ontario Support Services website is also available to connect all of those who are isolated and vulnerable to meal services and essential delivery services. Next slide, Dawn. Caregiver Connections Waterloo, Wellington. If you're caring for someone you love, if you're a primary caregiver for a spouse, a family member, a parent, friend, or neighbor, they're here for you. They're an online community and social learning platform for those who provide care to an aging family member in Waterloo, Wellington. They also have a Facebook group. There's Here for Help. They offer mental health resources specific to older adults and caregivers during COVID-19. As well as Connects Ontario, which is a free phone line to learn about mental health services in Ontario. And a plethora of available services as listed here for friendly telephone conversation. We can't see people face to face as often as we would like to, but to speak to someone, a friendly voice on the other side of the phone, can often make your day. So please know that we're here for you, and we will continue to be here for you. We're just a little bit different. Thank you.
Thank you, Cherylee. It's so helpful to know that there is so much out there for people to take advantage of should they need it. It's often been difficult to navigate what services are available, what services are closed, what services have shifted their delivery pattern or format during COVID-19. So thanks for bringing some clarity to that. That's very helpful. We've arrived at the point of our session where we're interested in taking your comments or questions or having a little bit more of a discussion. So we invited you early on to post your questions in the Q&A section. Now I know we have one question at this point, and it's a pretty easy one. The question is, will the slides be available at the end of the presentation? And the answer is, of course, yes. You'll be receiving a copy of the slides from today's presentation and a recording of the video in an email that will come to you. One will come to you later this afternoon with a survey. I'll talk more about that later. And we'll have the video come to you next week. So happy about that. We also wanted to apologize. It's come to my attention that of the over 100 registrants we have today, that a few of you experienced a challenge in logging in on time. So we apologize for this inconvenience, but know that you won't have missed a thing when you receive the video. You can follow up on that. Somebody has asked, can we get a list of services? And yes, that it went by too fast, and those will be included in the PowerPoint presentation as well. We have a question here now. How can you help an elder who is not able to see or accept their mental and physical health issues? I have sought support in many ways from my elder parent, but they do not want to try new strategies and are resistant to medication, which has negatively affected them. It is a constant struggle. So I welcome one of our guests to tackle the question, how can you help an older adult who's not able to see or accept their mental or physical health issues? Is there something we can do?
Yeah, I'll just start off, and I think we can perhaps do a little bit of a panel discussion here around that question. That's a great question, because a lot of people can be resistant to help, and when a caregiver sees, or a family member sees somebody struggling, what they want to do most of all is to help, and it's very hard when the person that you care for doesn't perhaps see it the same way. So I think one of the things that our teams do, and they do very well, is they partner with families. They partner with, the person we're very person-centered, right? So we want to be able to look at the whole picture and unpack what's going on. So we look into everything from, their social history, their current connections, everything leading up until the current moment that might influence why they might be resistant to support. So I think that's at the heart of what we do. And I would turn to maybe Heather and Cherylee to comment on some strategies that you both use in your clinical work with older adults when you come across these situations, because like I said, this is really at the heart of what we do.
Do you want to start, Cherylee, or?
You go ahead, you start, and then I'll finish up, Heather.
Okay. No, I just wanted to echo what Victoria said, that this is certainly something that's very challenging for family members, because you're recognizing something, you're concerned about your loved one, and you're just wanting them to kind of be connected to some additional supports. I agree with Victoria that we do try to kind of partner with individuals and with their families to try and build a bit of a relationship. Sometimes that's the starting point, is just by helping to demystify what it's like to maybe be connected with some of the service providers, to talk about what the options are, and to kind of maybe even come back several times to have those discussions until people feel slightly more comfortable. I'll be honest, there are times that it doesn't feel like it goes very far initially, but sometimes it's about continuing to try over time, and just kind of continuing to be persistent. One thing I will say, if you have concerns about a family member, about how they're doing or about their health in particular, you can always kind of share information with the family doctor about that person. So if it might be something about, say, their living conditions that the doctor might not be aware of, but that could be adversely affecting their health, even if my family member hasn't given permission for their doctor to speak with me, I can still provide information and the doctor can receive that. And that can sometimes be very helpful if there's a situation where there's a great deal of risk and concern. But certainly, I think it's really about, my experience has been, it's really about starting to build that relationship and talking about the menu of possible options that are out there. And sometimes even if we can start with one small change, that can lead to some further changes over time.
Yeah, thanks, Heather. I guess in my role, and I'll go back to what Heather said about building rapport. Often we get asked to see a senior, and there's a whole list of issues and concerns that perhaps the senior himself doesn't recognize, but the family does. So we piece out what is the most important thing to work on first, and we will often just do that by first building that relationship. We don't come in guns a-blaring. We can come in our role as just, you know, a friendly face to help have a conversation about, you know, what their concerns are. And we focus around safety, and we focus around, you know, what the client's needs are as well, recognizing that, you know, for these folks that don't really have a lot of insight into what we see from the outset, it's going to take time. And that's one of the biggest things with our elderly folk, is that we can't rush things. We have to find what's most important, work on that goal, and then hopefully work on another goal. And, you know, in our services with CMHA, we are not limited to, you know, one quick visit, one quick phone call. We have the ability to be flexible and change with every person we support. And we have to recognize that what a caregiver sees as, you know, a goal, an issue, a concern, might not be what the main concern is for that person that we're supporting.
Wonderful answers to those questions. So thank you to all of you. We have a few more that have rolled in, thankfully, but brilliant responses. Is it possible for a person living with dementia to access mental health support? And the background here is the person has recently been diagnosed with dementia, has some insights, looking for some mental health support, but not ready for structured counseling. Is there something we can offer someone with dementia?
And I see that Heather and I are both nodding our heads yes. 100%. And that is, again, within CMHA and our senior services, we do have a team in Guelph, Wellington. Right now, CMHA oversees Guelph, Wellington, and soon to be Cambridge. And we are involved to a certain extent in Kitchener, Waterloo, but what we have is a team of mental health outreach clinicians. And when we receive a referral, we do receive referrals via family doctors, which is why we're really emphasizing today to reach out to your family doctor or your loved one's family doctor if you have any concerns at all, because they in turn can make a referral to us. And certainly we understand that if the person isn't prepared to do counseling or able to do counseling, what we can offer is a comprehensive assessment to figure out exactly what the needs are. And we do that as a partner. We come in as a visitor, and we know that you are the experts on your own lives. And so we take that stance and we work with you to complete that assessment to better understand all of the needs and what good next steps might be. So that's a longer answer to, to the question, but absolutely 100% yes, there's help for mental health concerns when somebody has a diagnosis of dementia.
And I'm just going to jump in here and say I agree with everything Victoria said. I couldn't have said it any better or more comprehensively. I would just encourage anybody who is struggling with memory changes, whether it's an Alzheimer's dementia or any other memory changes, that the Alzheimer's Society is an amazing resource in this region in terms of providing education about the different types of dementia or the different types of memory problems, support for caregivers and families, lots of social activities, most of which is online at this point in time, but and maybe a little bit more informal. If a person isn't ready for maybe formal counseling, there may be some informal supports in speaking with other folks who are living with this type of illness, or just kind of sharing kind of where they're at. They also have kind of one-on-one supports available through social work as well. So a great resource that you may or may not be aware of.
Nice segue, Heather. We've had some recognition of the benefits that social workers offer, and thankfully we have a few of you here with us today. This person asks, who can I call to get connected with a social worker from the program? What's the pathway?
So if you're wondering about the CMHA seniors mental health program, again, you need to go through, the best pathway is to go back through your family doctor to have a conversation, and that's where it all starts. Because sometimes, depending on where you are and depending on what family health team your doctor is with, or depending on what structured practice your family doctor works within, will influence the referral pathway. And sometimes social workers who have experience in geriatrics are connected with the family health teams. And so that might be a good choice. But if you're experiencing mental health issues that are concerning to you, then your family doctor, again, needs to make that referral through to CMHA. And we're called the Specialized Geriatric Services. If you mention that to your family doctor, then they can explore that as a potential referral.
So here's a challenge. This next person says, our family doctor recently said that dementia is a normal part of aging. So one of our myths, right? The person asks, so how or where do I find a doctor or professional to assess my dad's memory issues? If you're saying it has to come through the family physician, are there other ways to access services?
That's such another great question. We just have so many good questions today. Yeah, so that is one of the myths that both Heather and I spoke to, that's certainly not an expected part of aging is for the memory loss. We have, in addition to mental health support, we have the discipline locally of geriatric medicine, and we have several memory clinics running in the area. So, and this is where your advocacy as a caregiver comes in, so that when you go back to your family doctor, and again, you're the expert in the life of your loved one, and so if you're seeing those memory changes over time that are becoming concerning, then certainly you can advocate to your family doctor for a referral. I would ask for a referral either to a local memory clinic or to a geriatrician, because a geriatrician can certainly do a fulsome assessment around memory and any cognitive issues, and you'll end up with an outcome and an answer.
Wonderful, thanks, Victoria. The next question, I think we'll take one more. This person says, my mother is living in long-term care, and I sometimes feel embarrassed to ask for help for myself, which I did previously for my mom before she was admitted to long-term care. This person is living with a cancer diagnosis and wonders if there's help available for her.
Yeah, cancer does not exclude you from, there are no medical conditions that exclude you from getting help if you need it, especially if you're feeling overwhelmed. And I'm so sorry to hear that you're feeling embarrassed, because that is what we spoke to today, and we want everybody to feel able and strong enough to reach out. And we know how hard that is sometimes, but we really wanted to debunk some of those myths. So I'll say again, cancer does not exclude you at all or in any way from reaching out to get help. And again, reach out. The first step would be to go back to your family doctor to open the pathway, just to have a dialogue and a conversation around how you're feeling and what your needs are.
And could I just jump in here and say that also being a care partner for somebody who is living with either a mental health diagnosis or a dementia also does not exclude you from reaching out for your own mental health supports, because these illnesses affect not only the person who has the diagnosis, but also their family. And these, being a care partner, as an example, for someone who has a chronic and persistent illness like a dementia, can be very exhausting. It can take its toll on your emotions. It can potentially trigger some mental health challenges as well. So, there are no exclusions. Please reach out if you're feeling like your mood or some of the things that we've talked about are becoming so intrusive on a daily basis that you don't feel you can cope. Please reach out for assistance. That's so important, and there are no exclusion criteria.
And I would say too, Dot, if I could just say something, that here 24/7, 1866, I believe, number is such a good one-stop shop. You're not talking to someone face to face. You can just feel what's out there, what support's available to you, and then they can make that referral, you know, for you. Maybe not through specialized geriatrics, but through our other streams as well. Because, you know, what we have learned is that, you know, being a caregiver, COVID, it's exhausting. It's hard. Everything is hard. So just don't feel guilty about taking care of yourself.
Great advice, everyone. Thank you for your responses to those questions. We've had one of our participants or someone watching from home also offer her advice from a lived experience perspective to the first question we had. How do we help someone close to us who's an older adult recognize that they may have a mental health or physical issue? This participant says that in her experience, a friend or a trusted or valued person of the senior may be able to have the ability to talk about difficult topics in ways that family members might not. So sometimes it's about timing, sometimes it's about who they might respond best to, sometimes it's how we communicate those concerns. They can have an effect as to whether or not the person will be more or less willing to see things that we're trying to illuminate. So this really does bring us to the end of our session today, and it's been my privilege right now to thank all of the presenters, Victoria, Heather, Sam, and Cherylee, for all they've shared with us today and for everything they do in our communities every day to keep us healthy and well and to care for us. And perhaps most importantly, I'd like to thank all of you for taking the time today to join us this afternoon. We hope you've learned something today. We hope you can take something away from this webinar. And finally, I'd like to thank our colleague Giselle Loyola for her expertise and partnership on the administrative and communication aspects of this webinar series. So immediately following this session, you'll receive a short survey questionnaire, and we very much welcome your feedback and encourage you to complete that. Finally, early next week, you'll receive a link to the session recording and a copy of the presentation's slides, if not later today. So once again, our community celebrates and thanks older adults for everything they do. Rest assured that we'll be together again someday soon. Again, thank you and take best care.